Gentlemen, what if I told you that what happens in the bedroom tomorrow morning is being decided tonight? Not by anything complicated, not by a prescription, not by a procedure, but by 3 vitamins you take before you go to sleep. What if the reason your morning response has been weakening, fading, or disappearing entirely has nothing to do with age and everything to do with a nutritional gap your doctor has almost certainly never addressed? Stay with me, because what I am about to share is going to change the way you think about your mornings forever. I am Dr. Amanda Brooks, a urologist with 12 years of experience helping men over 60 reclaim their vitality, strength, and confidence. I have worked with thousands of men who walked into my office convinced that what they were experiencing was simply the unavoidable reality of getting older. Men who had accepted the decline. Men who had stopped expecting anything different. What I found in case after case was not irreversible aging. It was a fixable nutritional problem. And the fix was simpler than any of them imagined. Before we go any further, hit that like button and drop a comment below telling me where you are watching from. Knowing I am reaching the men who need this most means everything to me. Let me tell you what is actually happening inside the male body after 60 while you sleep, because this is where everything begins, and almost no one is talking about it clearly. A healthy male body experiences 3 to 5 nocturnal erections per night during REM sleep. This is not incidental. It is biological maintenance. Each of those nocturnal events delivers a fresh pulse of oxygenated blood to the penile tissue, keeping the smooth muscle cells healthy, flexible, and functional. Think of it like a nightly pump test, your body running quality control on one of its most important vascular systems while you rest. But here is what happens after 60. Testosterone levels have been declining for decades. Nitric oxide production, the molecule your body uses to signal blood vessels to expand and allow that oxygenated blood to flow, has dropped by as much as 75% compared to your 20s. The smooth muscle tissue inside the corpora cavernosa, the chambers that fill with blood during an erection, begins to lose elasticity. Collagen builds where healthy muscle should be, and the result is not just a weaker morning response. It is a vascular system that is quietly, progressively losing its conditioning, because the nightly maintenance cycle that once kept it sharp is no longer functioning at full capacity. This matters far beyond the bedroom. Penile health is a direct window into cardiovascular health. Research published in the Journal of Sexual Medicine has consistently shown that erectile dysfunction in men over 50 is one of the earliest and most reliable indicators of systemic vascular disease. When the morning response weakens, your body is telling you something important about the health of your blood vessels everywhere. Your heart, your brain, your kidneys. This is not vanity. This is a vital health signal, and it deserves to be addressed with the seriousness it warrants. There is a third dimension that most men never consider. The hormonal cascade that governs sexual health is profoundly sensitive to micronutrient levels. Testosterone synthesis requires specific raw materials. Nitric oxide production requires specific cofactors. Vascular repair and smooth muscle function require specific nutrients. And after 60, dietary intake of these nutrients is almost universally inadequate. Not because men are not eating, but because the aging body absorbs and utilizes certain vitamins at a fraction of the efficiency it once did. The gap between what you consume and what your cells actually receive widens with every decade. And that gap is exactly where the 3 vitamins I am about to share you make their most profound impact. So let us talk about them in detail, with the biology, the evidence, and the exact protocol. The first vitamin is vitamin D3, and I want to be very specific here because not all vitamin D is equal, and the dosing matters enormously. Vitamin D3 is not simply a vitamin. It functions more like a master hormone in the male body. There are vitamin D receptors on the cells of the testes, the very cells responsible for testosterone production. When those receptors are adequately saturated with D3, testosterone synthesis increases measurably. A landmark study published in Hormone and Metabolic Research found that men who supplemented with vitamin D3 over 12 months experienced a 25% increase in total testosterone compared to placebo. A 25% increase, without a prescription, without a procedure, without a single side effect. But the testosterone connection is only the beginning. Vitamin D3 also directly stimulates the production of nitric oxide synthase, the enzyme your endothelial cells use to manufacture nitric oxide. More nitric oxide means wider blood vessels, better circulation, and a vascular system that responds the way it is supposed to during the nocturnal events your body relies on for maintenance. D3 also reduces systemic inflammation, which is one of the primary drivers of endothelial dysfunction in men over 60, the condition in which blood vessel walls lose their ability to relax and expand properly. Emotionally, what vitamin D3 restores is not just a physical response. It is a hormonal foundation. Men with optimized D3 levels describe feeling more confident, more driven, more present, qualities that are inseparable from healthy testosterone. The body does not distinguish neatly between physical vitality and emotional vitality. They are the same system. And D3 supports that entire system at the root. Practically, here is your protocol. Take 5,000 IU of vitamin D3 with K2, always with K2, which directs calcium to your bones rather than your arteries. At night, with your largest meal or with a small amount of healthy fat, since D3 is fat-soluble and requires dietary fat for absorption. Have your 25-hydroxy vitamin D levels tested. Most men over 60 are deficient. Optimal levels are between 60 and 80 nanograms per milliliter. If you are significantly deficient, your physician may recommend a higher loading dose initially. Do not supplement blindly at very high doses without monitoring. But do not accept deficiency as normal, because it is not. David, 63, came to me having not experienced a reliable morning erection in over 2 years. He had normalized it completely. His blood work showed a vitamin D level of 18, severely deficient. After 3 months on D3 with K2, he came back and said something I hear often from men in his situation. I thought that part of my life was just over. It is not over. His morning response had returned. His energy had improved. His mood had shifted. 1 vitamin. 3 months. A man reclaimed. The second vitamin is vitamin B3, specifically in the form of niacin, not niacinamide. And this one is extraordinary, gentlemen, because its mechanism of action is almost perfectly aligned with what the aging male vascular system needs most. Niacin is the most potent natural vasodilator known to nutritional science. It works by directly triggering the release of prostaglandins in the vascular walls, causing blood vessels to expand rapidly and dramatically. This is why high-dose niacin produces what is known as the niacin flush, a warm, reddening sensation across the skin that many men find uncomfortable at first, but which is simply the sensation of blood vessels opening. That flush, which typically subsides as the body adjusts over 2 to 3 weeks, is the same mechanism that begins restoring vascular responsiveness in the penile tissue during sleep. A study published in the Journal of Sexual Medicine specifically examined niacin supplementation in men with moderate erectile dysfunction and found that after 12 weeks, men who took 1,500 milligrams of niacin daily showed significantly improved erectile function compared to placebo, with the greatest improvement seen in men who also had lipid abnormalities, which is extremely common in men over 60. Niacin simultaneously raises HDL cholesterol, lowers triglycerides, and reduces LDL particle size. It is, in a very real sense, a cardiovascular intervention that happens to profoundly benefit sexual health as a direct consequence. The emotional significance of this is worth naming explicitly. When a man begins to experience reliable morning erections again after years of absence, something shifts in him that goes far beyond the physical. It is a signal from his own body that he is still vital, still capable, still fully himself. That signal has reverberations in his confidence, his relationships, his sense of identity. I have seen it change men, not incrementally, fundamentally. Practically, begin with 250 milligrams of immediate release niacin at night with food. Increase by 250 milligrams every 2 weeks until you reach 1,000 to 1,500 milligrams. Take it consistently, at night, because niacin's vasodilatory effects during the nocturnal hours align perfectly with your body's natural maintenance cycle. If the flush bothers you, take an aspirin 30 minutes before. It dramatically reduces the flush sensation without affecting niacin's mechanism. Extended-release niacin reduces the flush, but is associated with a higher risk of liver stress at high doses. Immediate release with patients is the preferred approach. Quick pause before we continue. We have covered 2 vitamins, and I want you to notice the theme. Both of these work through vascular mechanisms. Both of them are addressing the root cause: blood flow, endothelial function, and the nocturnal maintenance cycle, rather than masking a symptom. The third vitamin works through a completely different and equally essential pathway, and it may be the one you need most. The third vitamin is zinc, and I know some of you are thinking that zinc is a mineral, not a vitamin, and you are right. But in clinical practice, when we talk about the micronutrient protocol for male sexual health, zinc belongs in this conversation unconditionally, because its role in testosterone synthesis is not supplementary. It is foundational. Zinc is the single most critical mineral cofactor in the enzymatic pathway that produces testosterone. Without adequate zinc, the Leydig cells in the testes, the cells that manufacture testosterone, cannot perform their function regardless of how much luteinizing hormone is present. Zinc also directly inhibits aromatase, the enzyme that converts testosterone into estrogen. In men over 60, aromatase activity increases significantly, meaning that even when testosterone is being produced, it is being converted to estrogen at an accelerating rate. Zinc acts as a natural brake on that conversion, keeping more of your testosterone bioavailable, meaning free and active in your system rather than locked away or converted. A study in nutrition found that men who were zinc deficient and supplemented with zinc for 6 months experienced testosterone levels that nearly doubled in 6 months. From a mineral that costs almost nothing and is available in every health food store on Earth. The implications of this for men over 60, a population in which zinc deficiency is extraordinarily common, partly due to reduced absorption and partly due to inadequate dietary intake, are profound. Zinc also plays a direct role in the health of penile smooth muscle tissue. It is required for collagen synthesis and for the regulation of smooth muscle cell function, meaning that adequate zinc supports the very tissue integrity that determines the quality and firmness of an erection. It is not just a hormonal intervention, it is a structural one. Practically, take 30 to 45 milligrams of zinc bisglycinate or zinc picolinate at night. These are the most bioavailable forms. Always take zinc with food, as it can cause nausea on an empty stomach. And always balance zinc supplementation with copper, 1 to 2 milligrams of copper for every 30 milligrams of zinc, because long-term zinc supplementation without copper can deplete your copper levels, which creates its own set of problems. Do not exceed 50 milligrams daily without medical supervision. Raymond, 71, had been on low-dose testosterone therapy for 3 years with modest results. His urologist, not me at the time, had never tested his zinc levels. When he came to my practice and we ran comprehensive blood work, his zinc was critically low. We added zinc bisglycinate to his protocol. Within 8 weeks, his free testosterone had increased by 40% without changing his testosterone therapy dose. His morning response became consistent and strong for the first time in years. His wife noticed before he told her. That, gentlemen, is the power of addressing the deficiency your body has been trying to compensate around. Here is your complete nightly action plan. Step 1. Take 5,000 IU of vitamin D3 with K2 with a small amount of healthy fat, avocado, olive oil, or a handful of nuts. Step 2. Take 250 to 500 milligrams of immediate release niacin with food, increasing gradually over weeks to 1,000 to 1,500 milligrams as your body adapts. Step 3. Take 30 to 45 milligrams of zinc bisglycinate or zinc picolinate with food, paired with 1 to 2 milligrams of copper. Do this every night. Give it 60 to 90 days. Then tell me your mornings have not changed. If you have been experiencing a weakening morning response, if you have been quietly accepting it as the price of getting older, I want to say something to you directly. You are not broken. Your body is not failing you. It is running a deficit that nobody told you existed. The machinery is still there. The capacity is still there. What has been missing is the raw material your biology requires to do its job. You deserve to wake up every morning feeling vital, capable, and fully alive in your own body. That is not a luxury. That is not something reserved for younger men. It is your biology, and tonight, you can begin giving it what it needs. If this reached you today, please like this video. Drop a comment below telling me which of these 3 vitamins you are starting tonight. Share it with a man who needs to hear this, and subscribe for weekly content that gives you the clinical truth about your health, without the filters. I am Dr. Amanda Brooks, reminding you that after 60, vitality is not lost. It is waiting to be awakened. Take care of yourself, and I will see you in the next one.